intense cramps, not being able to function, bedridden on occasions. I remember someone took me home from high school once, and I don't remember how I got home. And my mom had said, this is not normal, and we need to look at what's going on. So thankfully, I had a mom that would listen. And of course, the answer then and always is birth control. So they put me on birth control, and that managed my symptoms for a very long time. And I remember being about 19 or 20 and trying to go off the birth control, and it was disastrous. Went right back to how I felt as a teenager and just miserable. So I went right back on it and didn't go off of it again until I was ready to have children. And in that time, I had various endometriosis symptoms, but I didn't know what endometriosis was. I never heard the word, never was mentioned to me by an OBGYN. I had no friends that had had it. It just never came up in discussion. But looking back at my journey now, I can pinpoint things that I was like, well, that IBS diagnosis makes sense. And those urinary symptoms all make sense. I got pregnant on my first try, so infertility wasn't an issue for me. And actually, my symptoms, and I think Niati is the same, didn't get really bad until after my second C-section. And then when that happened, I presented with a lot of rectal pain and pressure, which just did not seem normal, and went through a ton of doctors and a ton of scans, and everything was pinpointed back to IBS and difficult periods, and it's normal, and could be in your head, and every other thing that we hear from doctors. And at one point I moved from California to South Carolina, and I was vacillating between yeast infections and bacterial vaginosis. Been married for 10 years, 12 years at the time. And the OB I was seeing had me convinced my husband was cheating on me, had me run a bunch of STD tests, which, I mean, I had I never even crossed my mind. And then I'm going home and yelling at my husband for no reason. And they had said, oh, we think you have vulvodynia. And they sent me to a vulvar specialist, and she was amazing and said, listen, you don't have vulvodynia. I don't know what you have, but we're going to figure it out together. And it was the first doctor that had ever said that to me. And that was right before COVID. So I was well into my 40s. So from 15 or 14, when I got my period, until 40s, did a doctor say to me, we're going to try and figure this out together. And through a series of ultrasounds and a biopsy, we determined I had adenomyosis. And she said, your symptoms are pretty consistent with endometriosis as well. And at that time, I had no idea what an excision specialist was or anything like that. And it was during COVID. So we decided to not do the surgery because no one was doing elective surgery at the time. And then I moved from South Carolina to North Carolina. Niati and I connected. She encouraged me to seek out care. I wound up having out-of-network surgery with an excision specialist, which, if anyone knows, it's very expensive, and I traveled out of state to do it. And 9 months after surgery, I wound up hospitalized with diverticulitis, which is common for a lot of endo patients once you start digging and looking at things. But the specialist that I seen kind of pushed me off. He was done with the surgery, didn't want to deal with any of the aftermath of what was going on. And I was still having issues, and 2 years later decided to have a second surgery with my OB/GYN here and my colorectal surgeon. And thankfully, the excision specialist, who is world renowned, although there are issues with him, he is an excellent surgeon, and I had no new endo growth, but my ovaries were adhered to my pelvic sidewalls. I had kept my ovaries, but had had a hysterectomy. And at that time, I decided to remove them and all of the adhesions and scar tissue from my first surgery. Still struggling with GI issues, although I have a wonderful GI doctor and we're working through those things, and go to a pelvic floor therapist regularly, and she's been amazing. So my biggest struggle now is inflammation, which we all know is common with endometriosis, the GI issues, long-term diverticulitis syndrome and constipation due to an overactive pelvic floor as a result of the endometriosis and the surgeries. So that's where I am.
Thank you so much for sharing. So yeah, the moment you realized something was not quite right was way back when in high school, correct? Yeah.
Yes.
And I think that's also what happened to Nayati, isn't it? Isn't that
Yeah,
what you shared in that
I'll
Facebook
go.
post that I had seen? Yeah.
Yeah, absolutely. So I'll chime in here, similar to Renee, or very similar to Renee's experience here. Since I started my periods, it was always heavy periods. Just couldn't wrap my head around it. Why is it so heavy? But I grew up in India. I studied and lived in India till I was 21, moved to Australia, but still not. I was always anemic, but that was kind of forgiven. I was being supplemented with iron, so the days were going on, and I was getting by the day. Uh, Similar to Renee, didn't have any fertility issues, got married, have two beautiful kids. But similarly, all my symptoms were at its peak after the birth of my son. Uh, Again, had two C-sections, and after the second C-section, all the symptoms started showing up. I couldn't get out of the bed if I was on my periods. The periods were that heavy that I was super anemic and had to actually go in for iron infusions every other week. But not one doctor said ever to get screened for endometriosis. My OB said, this is normal, this happens. I got put on Mirena, the IUD, to help with the blood loss. That worked for 3 months, but then unfortunately the IUD flipped around and I had to go in for a DNC and get it removed. He did offer me ablation at that time, and thankfully my husband convinced me, one thing at a time, just get the IUD removed. We don't want to look at anything else right now. And for a change, I listened to him, and I'm grateful for that, that I didn't go for the ablation. But by profession, I'm a food scientist. So I was working on something super heavy on caffeine that day. And that day, I couldn't drive myself back from work. I literally had to stop by a gas station, buy Advil, take Advil, come home. And I called my husband. I was like, I can't look out for the kids today. I'm miserable. You need to drive home. He comes home and he goes, this isn't normal for you. Like something's awfully wrong with you. I'm going to call somebody to look after the kids and I'm taking you to ER. Super grateful to that ER doctor. Because every test came back normal. Ultrasound came normal. Everything came back normal. And he goes, have you ever been screened for endo? And I was like, what's that? And that is 2020 February. So a silver lining with COVID, apparently, we all had the time to research and look for the best doctor out there. Because February 2020, I hear the word endometriosis the first time. By March, I already looked into Nancy's Nook and all the other Facebook groups that are there for endometriosis. And it's like, okay, let's move forward. Let's do this. But then the world shuts down on us, right? Fast forward 2021, I got a surgery done where they excised endo from 13 spots. And I also had to undergo partial hysterectomy as I also had adenomyosis. Even at my 6 week, I was like, I'm still in pain. Something's not right. I was said that, oh, you've had a major surgery. It takes a while for everything to adjust and your body to come back to normal, but keep on going. A year later, I just told my primary care, I was like, given my history, can you just write an MRI for me? Because I am still in awful pain. And then the MRI showed that I had endometriosis growing in my abdominal walls. And had a surgery scheduled here at Cedar Sinai for that, but we happened to be back in India and consulted a doctor there who's very well renowned as well for endometriosis. And the confidence that he showed, and once he explained how intense that surgery would be, I think me and my husband were sold that if I'm getting this surgery done, it's going to be with this doctor, nowhere else. And thankful that I was able to do that. It was rough 6 months as I couldn't bend, I couldn't lift, I couldn't do a lot of things that are just normal day-to-day things that we have to do. But have to say that I'm pain-free after. I do not have any chronic pain, and that is a huge thing that every woman should have. So Yeah.
Thank you, Nayati. So it sounds like Renee was put on birth control almost immediately, but you were only on the Mirena after
After my son
your,
was born. Yeah.
yeah, afterward. Was birth control part of the equation for you, Naba?
It was. Yeah, it definitely was almost right from the start. And, there's so many similarities. I mean, I haven't met any of these two wonderful women before, but there's so many similarities in the journey and the symptoms and all of that. For me, and it's always such an interesting question for me to answer. Like, it's always a little bit difficult because, it's when you look back at the journey, you see that all of these symptoms were present since day one. But in the moment, I didn't know for many, many, many years. So I'm 35 now, and I don't remember when I first got my period, but I remember it was like irregular from the start. And for a little while, I remember my mom was like, worried that, okay, you're not regular and things like that, but I didn't pay much attention to it. But when I remember, things got really bad was like something that sticks out to me, a core memory in high school was worrying about, like, I didn't understand how nobody else seemed to be concerned about bleeding through on their period. Like I would just be sitting in class and I would be like in my mind in chemistry class, the only thing running through my head would be, can I sit here for another 20 minutes or do I need to run to the bathroom? And I just didn't know how nobody else was freaking out about that, and it was one of those things that, like many other things, I ended up internalizing. I said, okay, I'm just somebody who overthinks. And, I pay too much attention to this. So it continued like that for many, many years. I had a lot of the symptoms, but similar to what you said, Renee, I went to the doctors early on, said, okay, I have like really bad cramps. I feel a lot of fatigue. It's always, okay, maybe, you should just try birth control. It's generally normal. Every woman goes through this. And so that was, essentially my like solution for many years up until I was about, I want to say maybe 25 or so. It was in 2018. So the summer of 2018, I had one of the most excruciatingly painful nights of my life. On that day, for about like 15 hours, I was essentially at home with two ovarian cysts rupturing. But I didn't know at that point that I should go to the ER because it was kind of a culmination of so many years of being told that, okay, well, it's just pain and you'll get over it. And I was on my period at that time too. So I said, okay, this is just a really, really bad cramp. And I didn't realize that until the following morning when I saw, okay, I had two little bruises on my hips out of nowhere. And so I went to the doctor, and honestly, even that did not give me any answers because basically the doctor sent me for an ultrasound. When it came back, he told me, well, you have cysts. There's not much you can do other than pain management. And so again, it was anti-inflammatories, and I tried that for a few months. And at some point I said, this absolutely, I do not feel like myself. So I went to the clinic and I asked for a copy of my ultrasound reports. And on that, I saw that there was indicated, one was presence of endometrial tissue, and the second was a blocked fallopian tube. And neither of those had been flagged to me. So I took that ultrasound and then I didn't have a family doctor at the time. I was living in Toronto, but my family doctor is from Waterloo. So I had to go to a number of walk-in clinics to finally get a referral for a gynecologist. And luckily, the person that I ended up with was an excision specialist, but similarly, I had barely heard the word endometriosis. I didn't know the difference between excision and ablation. If it was an ablation surgeon, like I probably would have gone forward, because there was no education. But so I was lucky in that regard. That being said, it was a very long process because, as we know, the wait lists are very long. So I was put on the wait list for surgery. I said okay to it right away because I was already in so much pain. I said okay to it. I was put on the wait list in like 2019. And then I didn't have the surgery until 2020. But in that time, so where I lived in Toronto was about a 15-minute walk from my work. And I would walk back and forth every day. At the peak of like my symptoms, while I was waiting on surgery, I ended up taking sick leave for about 8 months because I couldn't do the walk every day. Like the walk back and forth, I would end up in a flare. I would have the endo belly. I would have so much inflammation and I couldn't walk the next day. So I ended up taking the sick leave. And I had and in that period, I was put on the Mirena IUD, which did not work for me. There was a lot, I had almost all of the horrible side effects. And every time I went back to the doctor, he just said, well, you must be really sensitive to hormones because there's a very small amount of hormones that's being released from the IUD. But in the meantime, it was pretty much 9 months of nonstop pain. A lot of like those intrusive thoughts and just a lot of fatigue that I couldn't explain. So when I had the surgery, I asked them to take that out. But I eventually did have the surgery. And when I did, they actually said it was much more complicated than they thought it was going to be. So they did leave some in there. The plan was to go back for a second surgery. So by the time that I'd gone in for surgery, it was deep infiltrating stage 4 endometriosis. It was rectovaginal. And so there was some that they had to leave in there. There was so much scar tissue. My uterus was shifted to the left-hand side, like the ovaries were adhered to the pelvis. There was a lot going on. The plan was initially to leave it in there and then for me to go on chemical menopause and then do a second surgery and then go back on birth control. But the second surgery was going to be very, very complicated. Like there was going to be a potential of a colostomy bag because of where the endometriosis was. There was going to be potentially like damage like to other structures. And I just didn't feel like at the age of 27, I didn't feel like it didn't make sense to me that that was the only path forward. And so I said, okay, there must be something else. And I switched gynecologists at that time. I worked with, if anybody's in Ontario or wants this information, there's at McMaster University, there is a really great endometriosis center, and his name is Dr. Leonardi. He does a lot of advocacy work too. You can follow him on Instagram, and he does a lot of advocacy work around endometriosis. And he put the notion in my mind that, this is a very active disease that's growing within you. And so you can't take a passive approach in that you have to take an active approach towards combating it. And so that started me on my journey to pelvic floor physiotherapy. And really that kickstarted a whole lot of, I would say, holistic care for me, because there was a very physical portion of, fixing my pelvic floor, which I know, Renee, you mentioned, and I love that you mentioned it because I think in endometriosis, we don't talk about the pelvic floor and pelvic health enough, even though that's where all the symptoms start. And it's so integral to our body in general. But it also, when you've been in chronic pain for so long, you end up disconnecting with your body and you just end up disconnecting from this very critical part of your body. And that kind of exacerbates a lot of the pain. And so learning to reconnect with that part of my body where a lot of the pain was taking place, it allowed me to separate my body from the pain. And it kind of allowed me to recognize, patterns within that pain and learn to treat it from a more holistic pattern or like a more holistic approach day to day.
Thank you, Napa, for sharing. And yeah, I love that it led you on that path to discover like more other holistic ways that you could help yourself. For those of you that don't know me very well, that's like one of my new love languages is like everything holistic. And I would say that even though I don't have endometriosis, um, my own health struggle, with Hashimoto's led me down, a path as well of discovering all of the holistic ways that I could help myself. And so I think it's a highly underrated path that not a lot of people know about, but it can be, super powerful, especially when you don't feel supported and heard by the medical system. Obviously, they can work in tandem as well. But yeah, on the topic of holistic care, Nayati and Renee, did you lean on any holistic practices to help you out, like through any part of your journey, like whether it be like diet or lifestyle modifications?
I follow a vegetarian diet forever, so that was always a big part, and I think that helped me keep my inflammation low. Not a lot of holistic things, but I definitely do fennel water in the morning, just a hot cup of water with 1 spoon of fennel seeds in it. And then I just make my typical traditional Indian tea. But the main reason I drink it is I put a spoonful of ginger in it for the inflammation. So those are the two main things that I still do. And then the big thing was acupuncture. I had never gone for acupuncture. Just the thought of somebody poking needles at me was giving me the chills. But before the first surgery, I think I had so much anxiety going in for it that I was like, I need something to get this anxiety out of me, and be in the right mindset before going into a surgery. And I want to say those 2 acupuncture sessions definitely put me in that reset mode. And didn't do it too many times. I've done it like 3 times that I remember. But acupuncture definitely helped get rid of some of the inflammation as well post-surgery.
I think holistically for me, some of it's been diet, especially with the diverticulitis. Looking at a low FODMAP diet to determine my triggers and then adjusting my diet from there. I've done acupuncture. I did it while I was pregnant with my son. I haven't found any great practitioners in the Carolinas, but I had a wonderful women's health acupuncturist in California. And I've done dry needling as well. I will say, I think it's important to stress with endometriosis that holistic care is important. I think it's one part of the picture, but it only treats the symptoms. It does not prevent the disease from growing. And because endometriosis can be detrimental to your organs, it's always important to continue to monitor your disease while maintaining a holistic approach. I think you can take things from traditional medicine as well as holistic medicine, but the danger with endometriosis is that it can invade your bowels or your bladder. There's many women that have lost and are on, do have colostomy bags. I know the percentage is very low, but it can travel to your heart and to your lungs and even in some cases your brain. So although I think there are so many good things about holistic medicine, it's important to continue to monitor your disease so you know where it is and where it has progressed. It's also important for me to express, I only had stage 1 and stage 2. I think both Niati and Naba probably had, Naba said stage 4 disease, but that didn't correlate to my pain. And that's also a misconception. There's people with stage 4 that don't even know it. And there's people with stage 1 in intense, incredible pain. So I think that's something to also take into consideration. I feel very lucky. I'm sure Niati feels the same way, that fertility wasn't an issue for me.
Absolutely.
I got pregnant very easily, but so many young women struggle with that. And their issue with treating this disease is that they're trying to preserve their fertility at the same time. We've passed that stage in life. And we're very lucky in that sense. But again, if you're having excision surgery, you might be trying to save your ovaries and ensuring that you can have a successful pregnancy. So there's so many layers to this disease and where you are as far as age, your goals in life. If you want to preserve fertility, there's so much. I see a chronic illness counselor that specializes in chronic illness, and that's been incredibly helpful for me. I think there's such a mental game with endometriosis between the gaslighting and what the disease does to your body and your brain sensors for pain, that it's important to continue to speak to someone. Niati and I talk through Instagram and support each other, but that support system is so important.
Yes,
I completely
absolutely.
agree with you, Renee. But it's surprising that my India surgeon, he doesn't actually classify endo in stage 1, 2, 3, or 4, because his theory is any stage of endo is bad. Just because I classify it as 1 or 4, that doesn't mean that you're suffering more and XYZ is suffering less. The suffering is equal for everyone. So he actually doesn't classify it at all, Renee. So my second surgery, he's like, nope, I don't do that. He's like, this is what I took out of you, and here's the picture if you want to look at it, So
to say I've consulted with Niati's physician. I respect him very much. You have to be careful. That's the other thing. There's so much pizzazz now with endometriosis specialists and their online presence and what they offer and whether they're covered insurance and not. And it's bad if you see someone that's just an OBGYN. What it really comes down to is you just have to do your research. You really just have to find the right surgeon for you. My second surgery was with my OBGYN. He did not have a great reputation 10 years ago, but he's learned over the past 10 years how to deal with endometriosis and has gotten a lot of experience under his belt. And my colorectal surgeon at Duke also has experience with endometriosis. So having them together in my surgery was important for me. You have to really dig deep. My first excision specialist, although is an amazing specialist, the partner he does colorectal work with is a general surgeon, not a colorectal surgeon. And a lot of people go into surgery with him thinking it's a colorectal surgeon when it's not. It's a general surgeon who does colorectal work. So it's really important individually to do your research. And I will say Nancy's Nook is a great starting point, but you need to talk to people who have had surgery with the physician that you're looking at. Reach out to them on Instagram, talk to them, ask them the deepest, most personal questions if they're willing to answer, because that's where you're going to get the information that you need.
Thank you so much for sharing that, Renee. Super important. Yeah.
I see a question here. What causes endo to grow? And I
Yes.
wanted to answer that. I don't think anyone knows really, but in my case, my second surgeon said the way my second C-section was done, that actually triggered a lot of my endo growth. If I put it in layman's term, he explained it to me that they remove 7 layers for a C-section to take the baby out, and then they're supposed to seal all 7 layers individually. The way he described it to me is that they just grabbed the 7 layers and stapled it in, kind of a thing. So he's like, imagine that's how it was done, and that caused the endo to grow more. I know Renee said that her symptoms were also like that after a second C-section, so I don't know if that's what we have in common here. But I know in my case, the second C-section was a trigger for the symptoms that I had after.
I think it's telling for me because two different doctors did my C-sections. So my guess is the first one closed me appropriately and the second time it did not. And again, there's no proof to that, just like there's so many other connections, is Hashimoto's connected to the endo. I have benign acrocyanosis and hyperflexibility. And although doctors have told me over and over again, it's not connected. If you Google it, Google says it is connected. So it's difficult because sometimes we feel like we know more than what our doctors know.
Yeah,
and some doctors hate us for that, Renee, and some doctors are a-okay with that.
Yeah. I've made quite a few angry. I've made quite a few angry. And my view on this is that we pay for insurance. We're paying the physician, especially when you're paying out of pocket. You have every right to fire or walk away from or deny care or a prescription or birth control from any doctor that prescribes it to you. You do not have to do what they say. You do not have to stay with that doctor. I have gone through, I don't know how many OBGYNs before I found one that worked for me. And that includes bedside manner. You don't have to tolerate anyone. The first OB I saw here was literally visibly angry that I paid out of pocket and went out of state to see a specialist. She was like, well, we do that surgery here. I don't understand why you didn't just do it here. But there had been a long history of people I had known that had incomplete surgeries with this particular doctor. So you don't have to stay with any doctor that you do not feel comfortable with, either because of their bedside manner or their plan of treatment or for any other reason.
I think you wanted to say something, Naba.
I mean, I was just going to respond to the I was just going to respond a little bit to the estrogen comment as well. And I think we don't know exactly what causes endometriosis. There's many different understandings about it, and even within the around the concept of estrogen too. What I understand is that it's not necessarily that endometriosis it doesn't necessarily cause you to produce more estrogen, but it's often the filtration of estrogen is slowed down. And so when they say looking at And again, I'm not a nutritionist either. For me, I've gotten to a point where I'm essentially able to, like, I eat relatively healthy, but I no longer do a very like restrictive diet. I tried it at one point, like I cut gluten, dairy, caffeine, essentially everything that they tell you to. After I started, understanding my body in like a more holistic way, I found that I didn't need to do that. I do still have some like the GI issues. Like I can't really tolerate dairy, but I mean, I think that's a lot of people. Spice, that doesn't really work for me. But with the estrogen component, I mean, anything that will increase your estrogen is typically good to stay away from, like, things that are generally not good for your health, either like things that are very high in sugar, things that are very fried and fatty. I find that with endometriosis, those kind of foods will kind of tip the scales closer to a flare, rather than if you don't have it. So your body does become a little bit more sensitive. But another thing that I would say that really helps too is like trying to track your cycle as well and really looking at what patterns appear throughout your cycle. From my perspective, I didn't do that very honestly for a very, very long time because with the endometriosis, when it was really bad, I kind of wanted to ignore it. And I absolutely hated my luteal phase. And actually, Crystal, your Instagram posts have like helped me kind of start to love my luteal phase. I will say that for this last month, I actually did not know I was in luteal until like 3 days before, no, 2 days before, and then it all caught up with me. And I was like, oh my God, we weren't expecting this. But with something like endometriosis or any chronic condition, I think our bodies and our minds, we get so used to distrusting and disliking the negative symptoms that we ignore the fact that if we can separate it, we can start to understand what patterns come up. We can kind of start to counteract. So if, like the certain foods that you can eat right before your period, and then, with endometriosis, if you can amp that up a little bit, then it will kind of help you to navigate it a bit better.
I love that you're tracking your cycle and that like you're starting to like it because that's another one of my love languages.
Well, I actually saw you did a post on this, Crystal, where you said that you need an app now to track it because you don't get the negative symptoms anymore, like of your cycle.
Oh, yeah, you're
You
right.
don't get the
You're right.
negative symptoms. And first I didn't understand that. And then this round I completely understood. I said, I don't know how I thought I was in my follicular this
Okay.
whole time. I was like, I was feeling great. You
Okay,
know?
I get it. I get it now what you're saying, how you didn't know. Yeah, yeah. So I think, as we move through life, we kind of got the message of like it's painful to be a woman, or like PMS is normal and all of this. And so, yeah, I feel like that's like one way that a lot of us know that our period is coming. It's because we have those symptoms. But the beautiful thing is, at least in my experience, is once I started like honoring my cyclical nature and kind of like working with my body and doing like these things to work with my hormones instead of against them, then yeah, all of those symptoms like actually they didn't just even fade, they completely disappeared. And so yeah, like you said, I need the app now to know when I'm in luteal and late luteal. So and then when the symptoms do start to creep up, it's like that's a sign to me of like, oh, what's imbalanced in my life? What needs more attention? And so I believe that the symptoms are like our body's way of speaking to us. And so our job is to learn the language of our body and to start listening, right? And earlier, when you were talking about foods that, exacerbate endo and whatnot, and you were mentioning, types of like sugary foods and basically all of the inflammatory stuff, right, will cause flares in people, whether you have endo or something else, like myself with Hashimoto's. So anti-inflammatory diet seems to be key for a lot of women. And when we're talking about estrogen and bringing that back into balance, and also, your body wants to use estrogen and then eliminate it. And that we don't want it to be reabsorbed into the body, right? And so there are some foods that we can consume that helps the body metabolize and eliminate estrogen. So all fiber is good for us. Things like cruciferous vegetables are supposed to be very helpful to help the body metabolize and eliminate excess estrogen. If you are not having a bowel movement every single day, this is, one surefire way that estrogen will just get reabsorbed back into the body, which is not a good thing. So if you're constipated, we can talk about ways to ensure you're having a daily bowel movement. Really, really, really important. Yeah. I think some questions might have popped up in the chat.
Yeah, there are two other questions that I can address. One is, anyone check blood sugar? I get really low blood sugar. I never checked it, but in my teen years, plenty of times that I've passed out, and it was probably because of my sugar had dropped from being on my period and all of that. The second one is, I've struggled with anemia since I started. I'm scheduled for an infusion next month, I think. Yes, I did infusions. I went in for 6 rounds. Were these helpful? Absolutely, to bring up my iron levels and my ferritin levels. But I would call it a Band-Aid solution, right? It brought up my iron levels back up. It brought my ferritin up. I had some sort of energy to get through the day to day. But I call it a Band-Aid solution because it's like, once those infusions stopped, again, iron levels started depleting, ferritin started dropping, till I found out the reason that why it's dropping so much. Why do I have such heavy periods? It's because of the endometriosis. So yes, it does. It did help. A disclaimer, I did 6 rounds without any issues. On the 7th round, apparently I reacted to Venofer, the iron IV. So now that's on my allergy list, that I'm allergic to Venofer.
There was a question too about nausea. I didn't really have nausea with any of my pregnancies, but afterwards that was a key symptom for me for the endo. In fact, after I had my son, my second C-section, if every morning driving to work, I thought I was going to be sick, and I thought, am I pregnant again? There's no way. And it was the endometriosis. I do sometimes take prescription anti-nausea drugs, but unfortunately those make you constipated, and that's part of my issue as well with my hypotonic pelvic floor. So I really try not to take anything on an empty stomach, vitamins, anything. I found that extremely helpful. I've adjusted how I take my medications, which has helped tremendously. Those are the two things that I've found that have worked for nausea.
I'll second the fiber comment that Crystal made earlier too, because now that I think about it, one of the kind of remedies that I introduced was just taking fiber supplements if I felt like I wasn't getting enough. I don't get the vomit, the nausea as much anymore, or like I very rarely get it. And it was never like that overwhelming for me. It was never like a primary concern. What did used to happen to me is I would get kind of like almost a fever right before I get my period. And amongst that, I would get like heightened sense of smell. And with that, I would get a lot of nausea in the morning. But when I did start introducing fiber and then also making sure that I was eating protein in the morning, that really helped to kind of stabilize my stomach. And so if I was going to get my period that day, then, the nausea would be lessened.
With the protein in the morning and the fiber. And I would say my GI doctor has said the same. Most women do not get enough fiber. We're supposed to get 50 grams upward a day. And most women living in America and the United States do not get that amount of fiber. And it's important, if you're not taking in that amount of fiber, that you start slow, because fiber can also back you up and cause all kinds of other issues. So if you are wanting to add more fiber to your diet, to do it slowly. Don't try to do all the 50 grams at one time, because that'll cause an opposite problem, but to keep that in mind. The other thing I wanted to just touch on is, we talked about it a little bit with the pelvic floor therapy, but I think a lot of women, number one, don't know what it is. A lot of women aren't prescribed pelvic floor therapy, and I have herniated discs in my back, and my neurosurgeon and a few other doctors have said every woman, regardless of if you've had babies or not, should have pelvic floor therapy. A lot of people are uncomfortable with it, some because of their experiences in life, or some just because it's an uncomfortable process. It's internal work, and that can be vaginal or rectal work. And it's super embarrassing. And you have to get over that fear and embarrassment, because it works. It really does. If you're seeing a skilled pelvic floor therapist, they really know what they're doing. And it's helped me so much with so many things. I mean, with endo, there's Painful sex is an issue, constipation, bladder issues, and a skilled pelvic floor therapist who's familiar with endometriosis can really help you through those things and also suggest things that you might not have ever thought about. My pelvic floor therapist has prescribed me rectal dilators, which have helped, a vaginal and rectal Valium, which I would have never thought of, but has helped tremendously. So I can't stress how important pelvic floor therapy is for women in general, but those with endometriosis especially. I think because it is a whole body disease, we have to look at treating all of the specific components at one time to get relief. Everybody looks at excision surgery as the gold standard, but no one really thinks about the long-term damage that the endometriosis has done to your organ systems or your body. And even if they excise all of the endo, or you're in menopause and it has slowed down, because I don't think menopause cures endometriosis, there's still so many things that your body, the damage that's been done and that your body's adjusting to. So continuing to treat yourself even after excision surgery is really important.
Renee, I think there are two questions that you could take. What do you recommend when looking for a pelvic floor therapist? And could you share some of the stuff your pelvic physio tells you?
Of course.
Julia has seen two and she didn't find it helpful.
So I think you need to look for someone who has specific endometriosis experience, because dealing with, a weak pelvic floor from pregnancy might be completely different than a hypotonic pelvic floor from endometriosis or surgeries. So I would specifically investigate research, talk to other people that may have visited that therapist, ask for recommendations in the endo community for your area. That would be one suggestion. My pelvic therapist does work with scar tissue, internal vaginal work to loosen muscles, to release muscles, to teach me how to relax muscles. I have an issue with mind and body connection for bowel movements now because of the hypotonic pelvic floor. So getting me to rectally do a Kegel and then release and bloom so that I can have a bowel movement without pain, without obstruction. Biofeedback therapy. I'm trying to think of what else. Stretching, rectal and vaginal stretching manually with her. It's a lot of intensive work. That's physically and emotionally draining. And it's hard to get over those first three kind of visits. But once I have a 2+ year relationship with my therapist now, we know each other really well. It's very comfortable, but she's helped me so much.
The other thing, if anyone does go forward with pelvic floor physio, so my experience was that I worked with mine I don't work with one now, but I worked with mine for about 9 months. And in the beginning, I saw her maybe 2 or 3 times a week for the first 2 months. And then after that, it went down to 1 week or so. Initially, I almost did not continue because it was super painful. And so when you're looking for a pelvic floor physiotherapist, yes, 100% look for somebody who has experience with endometriosis, as well as somebody that you're comfortable with, that can kind of walk you through the stages. I will say the person I worked with, she was technically excellent. She did a fantastic job. She did not, however, tell me to watch out that I might experience pain afterwards or that I would be really fatigued afterwards. I just ended up staying with her because, I was really desperate for solutions, and because I did the research myself and I thought that, okay, this seems to make sense. But when you do, with endometriosis, because so much of the impact, like Renee's saying, is musculoskeletal, you can get muscle knots anywhere, right? You can get myofascial trigger points anywhere. And that often does happen in inside rectally, vaginally, and anywhere in the pelvis. And so releasing that, if you've ever gone for a massage and felt really tired afterwards, it's similar to that. But there's a lot of, the pelvis also does hold a lot of emotional burden that we do get with endometriosis. Month after month, we're in pain. And so, be prepared to feel, that kind of emotional exhaustion, physical exhaustion for a little while afterwards. And I'm so glad that I didn't stop, because it took about 6 weeks for my body to adjust. and to not feel bad anymore. But once I stopped feeling, the negative side effects, it was like pure recovery from there on.
Super helpful. Yeah, thank you. I've also seen a pelvic floor therapist for other things. So just, since I'm in the field of women's health and wellness, like I don't ever want to recommend something that like I haven't experienced myself actually. And I was experiencing some tailbone pain issues and things like that. So I went and I saw someone and I was just really amazed at like how professional they are. Like I shouldn't be amazed, but like they're really so professional and it's just like what an amazing technique to, to bring relief to the body. Um, I also read a book. I don't know if this would be helpful to anyone, but if ever you wanted to explore more of like a self-release type of massage, there's a book called Wild Feminine, and it's by, let me check my bookshelf. Um, the last name is Kent, Tammy Lynn Kent. Yeah. And she leads you through how to do like your own internal massage. And that can sometimes, I don't know for endometriosis specifically, but we accumulate a lot of tension as women around our pelvis, whether you have endometriosis or not. So that could be perhaps one avenue as well.
Floor
Um,
therapy is a lot of homework too. I mean, I think that's why it doesn't work for a lot of women because they want to leave it in the pelvic floor therapist's hands, but I have to do massage. It's not the most comfortable area. If you have children, you have to find time when it's private. There's a lot
yeah.
of other things that go along with the homework part of it, but there's a lot of self-work that you have to do with pelvic floor therapy as well.
Okay, good to know. Thanks,
Yeah.
Renee. Yeah, beautiful. Yeah, and I think anytime we have an opportunity to, just get literally get more intimate with our body in this sense, it's a beautiful thing. And I think once you start to understand your body more and listen and honor it, there's like a natural type of like self-love that, starts to emerge. And we start to, I think, show up differently for ourselves as well. We start making different choices because we want what's ultimately best for us. We're not ignoring the symptoms anymore. We're trying to figure out how to send our body more love. What does it need?
Someone that they said, thank you for mentioning that menopause doesn't cure endometriosis. And that's very true. There's plenty of women in menopause that have active endometriosis. I think the big fear for me, I had a hysterectomy 2 years ago. I did not remove my ovaries because the doctor said if they were healthy, we should leave them. And I agreed with that decision at the time. But my ovaries pretty much shut down after my hysterectomy. I went from perimenopause right into postmenopause. I didn't even go through menopause according to my hormone levels. And I now see a menopause specialist that specifically gives menopause. And the scariest thing for me is adding estrogen and HRT back into my life as someone with endometriosis. And I started very slowly with progesterone first, bioidentical progesterone, and then um, suppositories of estrogen, so Vagifem suppositories, which I do twice a week. And I just started the lowest dose estrogen patch this past week. Paranoid to do so because you just never know. But I know to monitor my disease, and if I start to experience symptoms, to talk to my doctor. But for me, the benefits of keeping my brain health and my bone health was important. And I think we forget how important HRT can be for women, especially with all the negative information that was out there previously. But everybody has to make the right decision for them. So that's something that I'm navigating now.
Yeah, thank you for mentioning that. And I think kind of on the same vein, there was a question that we might have missed. So Jenica asked, and well, she stated that endo affects many systems in the body. So the nervous system, the digestive system, your hormones, and so on. And so she asked, how do you monitor your disease that it's going in the right direction? What tests do you do?
Orange, which is both anxiety producing and
I,
great for managing symptoms.
I didn't hear
So
what you said at first.
I have an aura ring.
Oh, an
That's
aura ring.
great.
Yeah.
But it
Okay.
does produce some anxiety. So if you're prone to anxiety, I would not suggest one, honestly. I got two when I first got it, which was recent. I got 2 nights of like, you're in stressful, whatever the signifying thing is for you. And I panicked a little bit. But I think that the tests that I've had aren't necessarily monitoring my disease as much as trying to um, eliminate what it's not, right? So a CT scan, a SITS marker test to make sure I didn't have gastroparesis when I couldn't have a bowel movement. I had a decography, which that's such a fun test because they inject a paste into your rectum and you have to poop in front of someone on camera. I mean, having endometriosis is not for the faint of heart because the tests are not so much fun to do. But honestly, I think if you're on a mission to have the best health you can have, you have to push for the tests that eliminate what else it could be so that you can get to the root cause of the issue.
Yeah, and I think I'll speak for myself. That's part of the journey that can sometimes be frustrating just because all of that takes time, right? And so as you're like working toward one thing, eliminating one thing, it's just like time goes by and you're still in pain or
And
suffering,
you
right?
have to find doctors that are willing to help
Yeah,
you because so many aren't.
yeah,
I shared with Niyati, I saw a functional GI doctor because once you've pretty much exhausted everything at your GI doctor, they send you to a functional GI doctor. And it started so good at the beginning and he had a great rapport. And then pretty much told me I'm not dying, that his patients are on pretty much on their deathbed. I have a good life. I should be happy that, I can wake up in the morning and I should just eat whatever I want and it's all in my head. And have I considered an antidepressant? I mean, I reported the physician. It was a really hard probably the worst doctor's appointment I've had. And that's a lot coming from someone with endo, because you have a lot of challenging doctor's appointments, but you have to really advocate for yourself. I really
Totally.
wanted to cry, like just break down and cry in that appointment. But when he said, I think you need to be on an antidepressant, I said to him, that's not your specialty. And I see a therapist that specializes in chronic illness. And I think if she thought I needed that, she would have prescribed me an antidepressant. That's not what I'm here for. So you really have to have a backbone and stand up for yourself. And even that alone is exhausting. It's exhausting. This is not a disease for the faint of heart. It really is not. It's horrible to say, and sometimes you don't have the strength to fight, but on the days that you do, you really have to fight for yourself.
yeah.
I think
That gave
Nava
me
mentioned
full body
here.
shivers.
Sorry, go ahead, Chris.
I just wanted to say that gave me full body shivers, like I've, yeah.
Nava mentioned here earlier that she actually got the imaging, not just the report. And I feel that's where half the problem is, because the people that are reading, or the radiologists that are reading the report, they're not trained to pick up endo on your imaging. So my India doctor, he's like, I don't need no reports. I just need you to get me the CD and just send me the images. So even my 2021 surgery, before the surgery, he had all the imaging for what I went for, like the CT and the MRI. He had both the imaging and he had picked exactly what I got excised here for. 2021 circumstances were different. I couldn't travel to India, and India wasn't allowed to do any non-urgent surgeries either. So I ended up doing the first one here in US. And even the second time I took my MRI imaging from here at UCLA, he's like, nope, I don't need this. I need my own imaging. And then he showed me the vast difference of just the imaging that was done 4 months before here in US and then what he did the day off. But I would highly suggest that if you're going for any imaging, make sure you get the CD or the imaging itself rather than the report.
If I could piggyback on that, because Niyati's physician reviewed an MRI of mine because I was still having issues after my surgery. He messaged me and said, your MRI report says that mesh was placed during your hysterectomy, and I see no mesh on the imaging. And he said, you need to go back and check with your physician and find out where's the discrepancy. And my physician, the first excision specialist I saw, who has a fantastic reputation, said, unfortunately, we're busy surgeons and we cut and paste our surgical reports. And I cut and pasted someone else's report into yours. And when I went back and looked at my report, there were many other discrepancies in my surgical report. So the atheist physician actually saved me in a sense, because he viewed the images versus the report and found that discrepancy. And he's in India, got back to me in an hour, whereas my physician here took 4 months to admit to me that he cut and paste my surgical report. So then I lost all faith and trust in my initial position because he lied to me. And again, here we are getting gaslit constantly and not having faith in the medical community. And someone who I paid an extreme amount of money to out of pocket cut and pasted my surgical report. But I would have never have known that if her doctor hadn't reviewed my images versus my report.
Wow. Big takeaway from today. Yeah. Haley says, goodness gracious. Wow. Do we want to talk about, because Renee had brought up the fact that you need to advocate for yourself. So did you want to speak to, what this journey has taught you about self-advocacy or listening to your body? Does that resonate at all with you? Do you have anything that you could share on that?
I think Renee mentioned it, but yeah, my first OBGYN, the one that helped me bring my son into life, he, even 2020, when I went back to him that, hey, my ER doctor says that I should get screened for endo. He's like, no, you can't have endometriosis. Everything's been normal for you. Everything's been perfect for you. Yada, yada, yada. And then, of course, Nancy's Nope comes into play. And this is still, like, I know Renee mentioned her age. Now I mentioned I'm 43. 2020, 2019 was still the age where I think Instagram and Facebook weren't this. Facebook was probably more popular. Instagram wasn't. But like doing your own research, finding out the resources was, I feel, not as easy as it is right now compared to even 6 years ago. And just finding out the doctors, there are doctors that charge me $1,500 for a 30-minute consult. And if I have to say, what did I get out of it? Absolutely nothing. And these are like renowned surgeons here in the US. They have a couple of books published. They have everything out there. But what did I get out of $1,500? Absolutely zero value. Like they just like, yep, we can do endosurgeries. This is out of pocket and we can pencil you in. But I think you have to find your own ways, find out the doctors that would truly listen to you. And I told Renee that, to be honest, it costs less to go to India, get an MRI and get a surgery done than to just get an MRI done here in the US. And the care that you get, the care that I got, I stayed in hospital for 4 days post-surgery compared to being an outpatient surgery here in the US. Nonstop support on WhatsApp, and anything that I ask for, the doctor himself gets back to me, not any admin assistants, So I think that was huge, especially because mine was a little more intense surgery with the abdominal wall endometriosis. They had to dig out 9 by 7 centimeter endometriosis from my abdominal walls, reconstruct my abdominal walls. So given the intensity of the surgery, I am so glad that I did it with a doctor who has thorough attention to detail and support for post-surgery as well.
Yeah, the last comment that came in, I'm sorry, I don't have your first name, but about the endometriosis stages, Nayadi was speaking about that earlier, how her surgeon doesn't. classify people in stages? Because how did you word it, Nayadi? Like all pain is,
Yeah.
how did you say it?
Stage 1 or stage 4, you are still in pain, and it's not fair to
Yeah.
label it as a stage 1 or a stage 4.
Hmm.
think
I would
more
say
and
like
more surgeons are moving away from the staging.
Okay.
Yeah.
Yeah, typically it's I mean the staging is and I think the lines between them are kind of blurred. It depends on like the severity of the growth within it, but yeah, absolutely 100% it's not correlated to your symptoms or to your pain. So from the patient side, it really doesn't matter if you have stage 1 or 4. But where it could matter is like from a medical perspective in terms of categorizing perhaps the level of care that you need like during a surgery. So with stage 1, typically you might have some presence of endometrial tissue, and then it depends where it might be too. With stage 4 is typically where you have like it can be very aggressive, or you have adhesions or scarring, right? So and it's also not necessary that it doesn't necessarily always progress. So it's not that if you have stage 1, you're going to definitely end up at stage 4. You can have like stage 1 or stage 2, and you can just stay there, as Renee was saying. And because there's not a lot of research being done or hasn't been done, we also don't like, there's a very good chance that if we do catch it earlier, you're not going to get to stage 4, but we don't know what that looks like right now. But yeah, absolutely. I mean, it doesn't correlate to the level of pain. Medically, though, if your surgeon is looking at the stage, it could help you to understand like how much scarring there was or how many adhesions there were or anything like that.
And your journey doesn't end with surgery. It
Yeah.
just, it doesn't. It's going to be a lifelong journey, and you're going to have to continue to advocate and listen to your body and find things that work for you, even after the surgery has happened. And you have to be prepared. I think Niati's situation's a little bit different because her physician is really amazing. But once your surgeon is done, he's pretty much done. The aftercare is really up to you, to seek, especially if you go out of network and it's not your OBGYN and you're paying out of pocket or going to a different state. It's really about you finding care providers where you are that can work with you to, address your GI issues or your bladder issues if you're still having them, or pelvic floor physical therapy or whatever it might be. You have to assemble a care team for yourself that's going to help you continue successfully on your journey after surgery.
Mhm. Yeah, I couldn't have phrased it better myself. Like it's so important to keep up with the care yourself after surgery. It doesn't end there.
So I see the time. We've got about 15 minutes left. So if you could speak to any woman, especially the women who are in this room, who are currently struggling and looking for answers, what would you want her to know?
Well, I'll say that I have a 19-year-old daughter, and I'm pretty sure she has endometriosis as well, which is my biggest fear. I was hopeful in the beginning because she had very mild periods, but she's getting rectal pain, and I actually didn't get that pain until after my second C-section. And I have just taught her to be strong and use her voice. I think that's the most important thing, is to use her voice. Her and I did a consult together with a physician in Charlotte where she's in school, and it was a good starting point for her. And we talked about next steps, but being 19 and being in charge of her own medical care, she's going to have to find and use her voice. Thankfully, she's like her mom, and she's strong and independent and will fight for herself. But I know not everybody is capable of doing that. So just encouraging them to find and use their voice and listen to their body.
Mhm. Yeah, and I would add on to that to say that like nobody is going to know your body better than you. Nobody is going to know your symptoms better than you. And so no matter how many people tell you that, or like questions the symptoms that you're having or try to chalk it up to something, if like in your gut that symptom is like that fatigue is not just random, it's not just because you were tired last week, then like continue sticking to that, because even if you haven't tracked it or you haven't put it on paper, the fact that it's there as a gut instinct is your body telling you that this is a pattern that has come up over and over again, and it's trying to tell you something. And like the advocating part for yourself is so important because nobody else can do that for you as well as you can. And that's also why I think like when you are able to track your symptoms and correlate them with, certain periods, like throughout your cycle, throughout your life, it's so helpful to have that. Put it down on a piece of paper and take it to your doctor so that, you're not just saying, oh, I have fatigue and I have pain and I have cramps, but you're able to say, well, my cramps are so much worse on day 2, and I have like extenuating fatigue that I can't get out of bed 3 days before I get my period, so then they also have something to work with and they know it's not just vague. And I think, yeah, the more information you can give to like your care team, the better they can help you, but you're going to be your best advocate.
Thank you for sharing, Naba. I want to also mention that if you are experiencing, like for the women who are still cycling, who still have a menstrual cycle, if you are experiencing like particularly painful periods, it can also be, yes, like due to stress and things that happened in the past month, but it can also be stress that's manifesting up to 3 months ago. So it's important to also look back, like what was happening 1 or 2 or 3 months ago. Like maybe you were like moving, or there was like some sort of transition in your life happening or something like that. And sometimes this can also manifest in the symptoms that we experience in our body.
There's a
Naya,
question here about
yeah,
GLP-1s for inflammation.
yeah. Before we get to that, did you have anything that you wanted to add about what you would want women to know who are struggling or looking for answers?
I think I'd say the same as Renee and Naba said, like advocate yourself, make sure your voice is heard. Just like Renee, I have a 14-year-old daughter, and just making her aware about what endometriosis symptoms are like. So not just her, even if she's talking to any of her friends and they say that I feel like this, I feel like this, then at least she's aware. And as I've told you, Crystal, many times, even if I can help one woman get diagnosed, that would mean so much to me. Just raising the awareness amongst the next generation, because I don't want their generation to suffer as long as myself and Renee have suffered. Like, I want them to get the diagnosis much sooner than 20 years or 25 years here. I think it's just about talking to the younger generation as well and making sure that they are aware about what those endo symptoms are, and they don't have to go through the whole cycle that unfortunately we've gone through.
Yeah, and speaking about how long it took to get diagnosed, like the stat that goes around is always like 1 in 10 women have um, endo, right? And it takes like 7 to 10 years to get diagnosed. But what I find is wild is that all 3 of you, it took you longer than 10 years to get diagnosed. And
Yeah.
Renee, it took you 30, right? Yeah, Nayati 24, Naba
Yeah.
11. And I think honestly, like if I'm being really honest, it's only because of this discussion panel where that stat came to life for me, and I realized, 7 to 10 is like way too long to begin with, but seeing your numbers, when we were talking about it, was just like it also made me realize that to get to that average, it means there are women that have suffered longer, have
Well,
struggled longer, to get the diagnosis, and that is just wild.
you know what's ironic is the first time I ever heard endometriosis and even thought that this might be what I have was from a segment on the Today Show, not from a doctor, not from a primary care physician, not from another woman. I saw a segment on the Today Show on endometriosis, and I was like, wow, that sounds a lot like what I'm going through. And that is the first thing that allowed me to start asking questions about endometriosis. Could this possibly be endometriosis?
Interesting. Yeah, so the GLP-1 question, does anyone have any experience with that? I have seen it like popping up on socials and stuff, but I haven't had a chance to research it personally myself. I don't know if anyone else either has experience or has researched it.
I
think it's
haven't personally, sorry, go ahead, Renee.
no, go, Nancy.
I haven't personally done it, but I see lately Dr. Second has been saying a lot about the terzapeptide, that it helps with endometriosis patients. Yeah, I mean, I got surgeries done for endo, but I still have Hashimoto. And what my doctor has lately recommended is maybe try low dose naltrexone, LDN. I'm still sitting with it. I think it takes a lot of courage to try out something new when you know that you have two underlying conditions. So I haven't personally done it yet, though.
It's like she said, Dr. Sechkin has talked about it a lot, but I think they're throwing GLP-1s at everything right now and seeing where it sticks. And just like anything, there's not a lot of research on it yet. If it does work, I think it's amazing and would be a great thing for anybody to try and use it to help manage symptoms and inflammation. So I'm hoping it's a good thing. I just would like to see the research long term.
Yeah, I think that's what's lacking right now is any long-term research on it, right? Hmm. Any final questions from anyone?
Yeah, if
Any
anybody
final?
wants to unmute and ask too, that would be awesome.
Did anyone want me to share the um, the links to follow Nayati, Naba, and Renee? You can follow them on Instagram, and then if any more questions pop up or anything like that, you can definitely get in touch with them. Any final thoughts from the panelists that maybe there's something on your heart that didn't have a chance to get expressed today that you would love to share? Naba, do you want to tell them about Pelvactive?
Oh, sure. Yeah, I mean, Pelvactive is kind of my passion project that I'm launching very soon. And it honestly came from the notion of taking an active approach combined with keeping a healthy pelvic floor and focusing on your pelvic health. And really, what it is it's my way of taking what I've learned, and I'm not an expert in any of these fields, but I've understood like what it means to go through endometriosis and the struggle that is required to actually go out and find the information. And it's really about connecting women with different resources that really target endometriosis, from like a pelvic health first perspective. And yeah, no, I mean, I would just end with saying, like, I know it is a very isolating and lonely journey. But there are so many of us, and I know often it doesn't feel like that because we're all going through our own journey. And I think half the time, half of us are in a flare and we're very tired and it's hard to connect. But just knowing that there are more of us out there, you're absolutely not alone. I see the support groups. I see, a lot of people trying to help one another. And so, yeah, absolutely. I would love to connect, reach out to any of us. Yeah.
Great, love it. Actually, on that topic, is there any resources that either of you know of that you would recommend or that you found helpful specifically?
The support groups are great, but you have to really filter the information. You have to use sound judgment. Everybody has an opinion and an experience, and just because one person had a horrible experience with the physician doesn't mean that everyone has. So I think just looking through it with a very investigative lens is important, and you have to take from it what is beneficial to you, and always do your research. I do think those groups help you to feel less isolated, but I think they can overwhelm you with information and negativity. So trying to stay positive in that space can be challenging sometimes.
Yeah.
I will admit to that, Renee. I have left every single endometriosis Facebook group because of that reason, because it wears me down at the end of the day then, because it's like 20 plus posts a day, and it's just yeah, some are misleading, some are, yeah. But I would say the accession list from Nancy's Nook, I don't follow that group either anymore. I don't know if it's updated, but that's where I found the accession list in 2020, and that's where I started calling out the doctors.
It's a great starting point, but she doesn't allow negative
Correct.
reviews. So be very careful. She
Yeah.
does some reviews, but there's a specific group of surgeons that she's apt to recommend and doesn't always allow reviews that aren't in a good light. She says that contain opinions, but I know several people who have submitted reviews on surgeons that have not been published, that were just factual, that did not have opinions. It's a great starting point. There's a lot of great information there. Just be careful and do your own research.
Somebody
Great
asked
advice.
about, well, this is Montreal specific, but somebody asked earlier about EndoCares in Montreal. And I haven't, I personally have not worked with them. I did try to get in touch, but they were very, very busy. But I have heard very good things. So they're relatively newer, like they've been around for a few years, but one of the things that they specialize in is putting together a multidisciplinary team for you. So, and the way it works is you do need a referral from a family doctor or like a clinic or wherever. I unfortunately don't know too much. I don't know about the wait list, but I have heard good things. And if you are looking for a diagnosis, then they will also like take you through the steps to do that. So EndoCares, they're affiliated with McGill University, so they also do a lot of research in the field.
For
Good to
the
know.
thoughts on how to fund some of the costs for excision surgeries for out of network, you have to take two or three things into consideration. I know not everybody has health insurance. We're blessed for those that do have it with out of network benefits. Two or three things to consider is if you are employed and do have a healthcare spending account, it's $3,000 a year. If you're married, have a spouse, that's $3,000 a year for them. That's $6,000. That's halfway to your surgery. Most surgeries in the US are about $12,000. If you have out of network benefits, the surgeon is not typically covered, but the hospital and all the care costs are if you've met your deductible. So having surgery towards the end of the year when you've met your deductible is probably a wise choice. I've also just reminded people that typically if you get paid every 2 weeks, if you're single, that's 2 extra paychecks a year. Put it towards a surgery fund. If you're married and your spouse is willing, use their 2 extra paychecks a year to put it towards their surgery fund. You can take out loans, which I don't recommend, but if your company has a retirement plan, oftentimes you can withdraw money as a loan from that and you pay the interest back to yourself, not to the 401k plan, and it does not affect your credit. Not all organizations allow you to take loans from your 401k or your 403b, but many do. And that is also something to look into that won't affect your credit and you pay the interest back to yourself.
Those are some great points, Renee.
Thank you.
Excellent. I'm just so happy that, you came together to share your knowledge. I would love to know from the people who are still in the call with us, what's one takeaway or something that resonated with you from our chat today, from the discussion panel today? And yeah, big, big, big thank yous to the three of you. Like the knowledge that you have between the three of you is amazing. I'm sure it's helped the people who are in the call. For anyone who's still here, you'll have access to the recording. I'll upload it inside the collective. You can join for free. And if for whatever reason you don't want to join the collective to have the replay, just reach out to me. I'll make sure to send it to you. The three beautiful women that are here with us today, they really wanted this message to get out to as many people as possible. So I would like as many of you to have it as possible. So if you have family or friends that could benefit from this call, we can share the recording with them as well.
Thank you so much, Crystal and Niathi, for inviting me and for putting this together. It's helpful for us too. It's cathartic for us to share our experiences. And like Niathi said, if we can help one person get diagnosed, it's a win for us.
Yes, I think we've reached our goal. I don't know if I mentioned it at the beginning, but we said, Nayati and I, if we can help just one person, this whole call will be worth it. So I'm sure that we've reached that goal. thank you to the three of you for your time and your sharing your lived, experiences and wisdom and advice and everything. So very, very grateful. Very grateful. Thank you so
Thanks
much.
to you, Crystal.
You, Crystal, yeah.
Mm.
Thank you for
Love
bringing
it.
us together.
Love it so much.
Thank
So
you. Have a great evening.
I hope everyone stays well. I hope you all have each other's contact info so that if questions arise after the fact, you'll have a reference point somewhere to lead you through this beautiful journey that you're living. Yeah, I hope you all have a great rest of your day, evening, whatever time it is where you're living. And yeah, we'll be in touch.
Thank you.
Thank
Okay.
you.
Bye.
Bye.
Bye.